After watching this video, you should be able to localize the lesion causing unilateral hearing loss, that is, hearing loss in one ear. And in order to do that, we need to review the auditory system. So let's start with the right ear. We have sound that's going to come in into the external auditory canal first. Then the sound's going to enter the middle ear. Then we're going to go into the inner ear where the cochlea is located. Then the action potentials are going to go along 8 into the cochlear nucleus. Now this occurs on both sides, and after the cochlear nucleus we have bilateral representation. Now, if we're going to figure out unilateral hearing loss then, which we can write out in red, the consideration then is going to be as far out from the external auditory canal, so we can put a line marking that. And then the lesion could also, of course, be in the middle ear. It could be in the inner ear where we have the cochlea. It could be the cochlear portion of cranial nerve 8 and the cochlear nucleus on obviously the same side as the hearing loss. So that's our list of possibilities. Just those locations. Anything after the cochlear nucleus would not cause unilateral hearing loss because the system's bilateral. Now, we can subdivide the unilateral hearing loss into conductive hearing loss and sensory neural hearing loss. So with conductive hearing loss, the lesion's either in the external or middle ear, and for sensory neural hearing loss, the lesion's either in the inner ear, for example the cochlea, the cochlear portion of 8, and the cochlear nucleus in the lateral medulla. And the way we can separate these two clinically is through the Weber test, where we use a vibrating tuning fork placed on the middle of the forehead, and we can compare the loudness between the two sides. If the sounds are louder in the bad ear, the ear with hearing loss, it's conductive. If the sounds are louder in the good ear, the ear that doesn't have the hearing loss, then we have sensory neural. And then, once we figure out that, if we need to further figure things out, we can look for neighborhood signs. This could be somewhat helpful. For example, cranial nerve 7 does travel with cranial nerve 8 out the cerebellar pontine angle and also out through the internal acoustic meatus. So because those travel together, we could end up with a situation where someone has a cranial nerve 7 lesion and a cranial nerve 8 lesion causing unilateral sensory neural hearing loss and the signs of a cranial nerve 7 lesion, which would be loss of all muscles of facial expression, loss of taste on the anterior 2/3 of the tongue, and lacrimation. Now that concludes this video on lesion localization for unilateral hearing loss.